Well, thank you very much, Madhu, and particularly thank you for that mercifully short introduction. Um, I am delighted to be here, and I'm delighted that you all are here. It is a pleasure to be able to present to you some of the things that VA is doing on the cutting edge of connecting patients to their providers and to their healthcare system. It's an exciting time in VA healthcare. We're moving to a new model of healthcare delivery, one that not only puts veterans at the center of their care, but empowers veterans to be the drivers of their care. We'll be able to go beyond simply treating problems and diseases. We'll be able to forge true lifelong partnerships with patients that optimize both their health and their well-being. It's a system designed around veterans' needs and lights a path to more options for care, greater access to providers through our connected health innovations. Now patients can choose to come in for a face-to-face appointment, avoid the long drive and the hassle, and instead connect with a provider through our telehealth programs, secure messaging, mobile communication strategies, and many other options. This is especially important for veterans that live in rural and remote areas, but it's going to apply to every single one of our patients eventually. We need to help veterans manage their care wherever they happen to be and whenever they need it, not when an appointment card says it's time to show up. The better patients are connected with their providers, the better their health and their well-being. This showcase is going to give you an overview and demonstration of innovations that VA is developing to connect patients with their information and services in this emerging digital world. I want to just take a moment and acknowledge our first venture. Dr. Agarwal tangentially referred to it, but we really started in the 1990s. Bob Roswell asked Adam Darkin, who's standing back here someplace in the back of the room, to begin to develop a telehome health program. And that was really our first venture into what we're now calling e-connected or connected health. So Adam, congratulations. You're going to get a glimpse of how the use of these new information technologies is transforming the healthcare delivery system and how it is affecting the health outcomes of our patients. One innovation you're going to hear about is called ScanEcho, SCAN-ECHO. This program expands access to specialty care for veterans living in rural and remote areas. ScanEcho uses video conferencing technology to link primary care providers with specialty care teams to locally manage patients with chronic illnesses that require complex care, thus extending the range, if you will, of the primary care providers. It helps us harness the knowledge and expertise of specialists and extend it out into the field, again, empowering the primary care providers. You'll hear about our mobile health pilot for family caregivers. Last fall, we gave iPads to about 1,000 family caregivers. The iPads were preloaded with mobile health applications that have been designed and created to support the needs of family caregivers and the veterans that they care for. These two innovations, and the others that you're going to hear about today, exemplify what connected health is all about. Connected health is the point at which healthcare meets information technology. We're using knowledge and skills in information and computer sciences, management, and healthcare systems to enhance the delivery of patient-centered care, proactive patient-centered care. I want to point out that everything that you're going to see demonstrated here today is a result of a collaboration between the Veterans Health Administration and VA's Office of Information Technology. And I see a number of people from OI&T here, and I want to thank them, congratulate them, and express my desire that we continue to have this collegial relationship and this partnership. We can't do this by ourselves. They can't do this by ourselves. This is something that takes a joint effort, and to date it's been very, very successful. We've partnered with the Office of Information Technology to harness the latest technologies and web applications to increase access and communication between veterans again and their healthcare providers. I invite you to join me in imagining what VA healthcare will look like in the future. Just a few years from now, the use of information technology will be routine practice in virtually all areas of care, from digital referrals to follow-up appointments, and from telediagnostics to monitoring and supporting the needs of patients in their homes. The majority of consultations will begin, at least, and probably continue to be done by video conferencing. So whether you're sitting 2 floors away from the specialist or 200 miles away from the specialist, the primary care doctor will be sitting at their computer with the webcam. They will dial up the cardiologist while the patient is sitting in the room, introduce the patient to the cardiologist, and the consultation will again begin there, and in many instances will be able to be continued and completed in that video teleconferencing kind of environment. We'll use the latest mobile technologies and applications to help people look after themselves, find the support they need to improve their health or the support they need to maintain their health. We believe that mobile technology will transform the electronic medical record from a single massive desktop application to a suite of mobile applications, with each app designed around a specific and special workflow. We believe using information technologies in this way is going to improve the lives of those who need our services while making the best use of our valuable resources that we offer in our hospitals and our clinics with our staff. We also believe these technologies are going to lead to better connectivity and ultimately better health care for our veteran patients. In 5 years' time, we're going to look back on this and we're going to wonder how we ever managed to take care of patients without these innovative technologies, which will then, I hope, be routine. In essence, these technologies make the most of encounters between patients and providers by ensuring that both patient and provider have the information they need to personalize patient care, meeting those unique preferences and requirements that each individual veteran may have. These technologies also empower veterans to take an active role in their treatment by better understanding the options that are available to them. One of the largest movements occurring in medicine in general is empowering patients to actually be in control of their health care. First principle of that is they must have access to their medical record. Blue Button and other technologies are allowing patients now to download their complete record. That's the first thing that needs to happen in order for patients to actually take control of their health care. And hopefully in the future, we'll end up being consultants, advisors, and people who carry out the wishes of the patients. And patients are going to have access to medical information and be so well educated about their diseases that they're going to be in a position to make those choices for themselves. And these technologies and this connectivity is a very important part of that. These technologies are also going to empower veterans to take an active role, as I've said, in their treatment by better understanding the options that are available to them. For instance, veterans can receive mental health treatment they need in their homes through telemental health services. They don't need to come into a clinic. Having the option to receive care from the comfort of their homes helps eliminate the fear of being stigmatized in the case of mental health, and improves veteran health outcomes and also improves compliance with therapy. Last year, we provided care to about 6 million veterans. In the next few years, as America turns the page on a decade of war, we expect that more than 1 million active duty personnel will join the ranks of the nation's 22 million veterans. It's imperative that we ensure that these men and women have access to high-quality health care. All of us that are gathered here in this room joining us, remotely, are united by a shared goal to ensure that our nation's veterans receive the best care available. They deserve it. They've earned it. I hope you enjoy the showcase. It is, as Dr. Agarwal said, an honor to work in an organization that is so filled with innovative, creative people, keeping us on the cutting edge of healthcare delivery. And we think this showcase is a wonderful demonstration of that innovation and creativity. Thank you.